I call the Mental Health Board meeting for February to call the meeting to order. And we don't have a quorum at this time, so we will postpone the approval of the minutes. Let me, let me discuss who the Mental Health Board is, what our function is. The Sonoma County Mental Health Board is an advisory board empowered to listen to the concerns of our constituents and to help formulate policies that offer a consistent continuum of care for all those with mental health challenges. We are further empowered to advise the County Board of Supervisors on the mental health care system, the mental health system of care. We support reducing stigma for individuals needing all levels of mental health care in all communities in the county, treating each person with compassion and respect, regardless of gender, sexual identity, and cultural or ethnic background, and acknowledging the influence of individual lived experiences. Working with the local mental health system to eliminate racism from our minds and hearts, and ensuring that our policies are equitable and benefit underrepresented communities. Acknowledging that environmental factors can increase mental distress and supporting efforts to reduce such stressors. Providing support to the families of those with mental health challenges. The Sonoma County Mental Health Board collaborates with the Behavioral Health Division of the Sonoma County Department of Health Services to increase public and professional awareness of individuals with mental health challenges. We strive to influence positively the mental health system by listening to public input and working with behavioral health services to create policies that will offer hope to individuals living with mental illness and to their families. I don't have any announcements at the moment. See. Do we have a consumer affairs report from a representative of the county? Is Kate Roberge or guests here?
Do not see Kate either. Oh, looks like somebody's raising their hand in the attendees. Michael can provide updates. I'll allow them to move them over to panelists. So Michael, you should be moved over.
Michael, were you going to be providing an update on consumer affairs or something on West County Community Services?
Yeah, so Kate is with West County, and I can give you an overview of each of the peer programs and what's happening.
Please.
With those. So we actually just had our semi-annual managers retreat last Friday, where we looked at achievements over the last 6 months and some strategic planning for the next 6 months, leading into the end of the fiscal year. The Empowerment Center out in Monterey is continuing to provide services, a lot of one-off services, folks coming in looking for assistance with paperwork and other things. Also continuing to provide services, including art programming and things at the Navigation Center, the Navigation site in Guerneville. The Wellness Center in Santa Rosa. There was some confusion that somehow information got out that it was closed through the end of February, but that's not accurate. We have the Wellness Center has continued to operate and will continue to operate with regular hours, growing momentum. We're continuing to get about 20 new members per month at the Wellness Center. The Petaluma Peer Recovery Center, we're adding members there. Participation is starting to increase. There's also a food program that's going in next door that we expect will bring in some additional traffic there that we can partner with providing some services. The peer education and training program will be starting its next peer specialist peer support specialist training class on March 8th. Technically, the deadline for applications was on the 10th. However, if someone is interested in getting into that class, you're welcome to still contact. I'll put Amy Breckenridge as the contact for that. I'll put her information in the chat for that. Interlink Self-Help Center, we are looking to hire for a peer specialist, substance abuse specialist position. So anyone that might know of someone who is an AOD who would like to apply for that, we'd love to speak with them. And the MST program, our peer outreach worker there is continuing to meet with folks at the jail, helping with those who are dealing with mental health challenges in that facility, as well as at the CSU, having some peer visits there. And I think that's a pretty good overview of all of our programs. If anybody has any questions, I'm happy to answer them. Michael.
Yes. I assume you've been doing video care up until this point. Do you plan to be transitioning into in-person care now that the mask mandate is being lifted, or is that going to be pushed back a little?
We have been doing in-person
great.
since about September of 21 or September of 20. I'm sorry. Yeah, we had a very short window where we were not doing in-person services, where we were just doing Zoom. Now we're doing a hybrid because there are still some folks who are not comfortable coming in, or transportation issues. And so once we started offering Zoom services, we have continued those, but all of our centers are doing in-person services.
Do you found it's actually been helpful being able to transition into more of a hybrid model, like you're able to reach more people?
You know, it is, we did find that there was some lamenting about having to do that, because obviously, mental health care is best in person. However, there are many folks who, distance, transportation issues for a number of reasons are not able to come to in-person services, which is why we were glad to continue offering some of the Zoom services, including we have smart recovery classes, which is a secular-based recovery program. We offer both Wellness and Interlink offer those through Zoom and in person. We have some anxiety groups and some other groups that we're continuing to offer through Zoom, and they continue to be well attended. So we're glad to be able to provide both of those services.
That's great. And then just as a last question, for the food program, what are the hours of operation going to be for that? Are you doing 3 meals a day, or what's that going to be like?
Yeah, I'm sorry. So that's not that's not part of our program. It just happens to be something that is coming in next door. Right now they're remodeling. It was a seafood market before, and so they're in the process of remodeling. But our hopes is that since it is going to be a hot meal service for folks, that will bring some more foot traffic. I don't know, the location for Petaluma Pier is in the County Behavioral Health Complex. And it's pretty well off the beaten path, so it's difficult for a lot of folks to get there. But we're hoping with the addition of that food program next door,
right,
that will bring in some additional foot traffic. And we have been communicating with those who are working in that program and looking to collaborate.
That's awesome. Maybe they could come and speak here at some point. I think that would be
okay.
Cool.
Yeah.
Any other questions or comments about Michael's report? Okay, thank you, Michael.
All right, thank you.
We have an opportunity now if there are any public members who'd like to make comments or express concerns or regarding accomplishments, impact of racial disparities, or other mental health related topics. We suggest a 3-minute limit normally. Are there any comments? I don't see any. Do you, Pilar?
No, there's no raised hands that I'm seeing or somebody has a comment, they can also, let us know in the chat as well.
Okay. Thank you. At this point, we have a special presentation. Msha is going to be presenting a topic, SRD drug and alcohol mapping study. Melissa?
Yes, thank you so much. Thank you for the opportunity to come to speak to you all today. I know this came up from a previous meeting, and I have a PowerPoint presentation. I'm see if I can share it and get that going. If you could open it up so I could share it since it's been disabled. Try it again. Oh, still disabled. Okay.
Should be able to now.
Okay, wonderful. Thank you. All right, here we go. So go ahead and do that. Get started on the slideshow. Okay, well, thank you so much again for having me here. Hopefully you can all see my screen. I am talking a little bit about this project that we actually completed in the summertime. It was an opportunity for us to do a full review of our substance use disorder services system of care. So we looked all the way from prevention and early intervention through recovery and treatment services. And we were really, I'll explain this a little bit more, but we were really looking at trying to identify any gaps that we have in our current system. And this also was very primarily, a big part of this was around getting enough information and be able to get us prepared to enter the Drug Medi-Cal Organized Delivery System, also known as the DMC ODS. And I'll explain a little bit more about that as I go through my slide deck. So I'm going to recap the project and talk about what we did. I'm going to talk about some of the recommendations that came out of the project. We'll talk about some of the next steps, which some of them have already been completed, but there's still some underway. And then I'll have a little bit of time at the end for questions and comments. So just to give you an overview of the project, we had particular goals, as I mentioned. This is a community-driven process. So we really wanted to make sure that we were engaging the community as much as possible. So we did so through focus groups, through surveys, and key informant interviews. So we had a lot of opportunity to connect with different groups, which it would really help to provide comprehensive information for this. And we were looking across, as I mentioned, the entire system of care, and we really wanted to understand the landscape it currently is. We wanted to develop an actual map and see how individuals are accessing our services. And again, we wanted to talk about and find those potential gaps and see where we might have some opportunities for growth. So, and that last piece I mentioned earlier was the need to really understand this and have this information in order for us to determine where we were in the process of preparation to enter the ODS waiver. So there were different phases that we conducted the system mapping project. We started with that discovery, where we actually did a lot of secondary data review. So we had, in preparation of our prevention work that we do in the county, we're required with the state to develop a 5-year prevention plan, strategic plan. And through that, we do a lot of data collection. We look across all the different trends that are happening in the county in Sonoma, whether it's the types of substances that are being used. We're looking at different, across genders, across race, ethnicity, all different types of demographics that we're looking at to understand what's happening in our county. So we took a lot of the data we had used to develop that prevention plan, that 5-year prevention plan, because we had just completed that process not too long ago. And so it was very convenient to be able to take a lot of that secondary data review and apply it here. And then we did do some updating of that as well. So that was during our first phase of this process. And it also involved a lot of conversations as part of that too. We had developed a steering committee and started to actually meet in the next phase, but we were connecting with experts in the field to get their input as well and help us with this process, because this is a really quite a big undertaking for us. So phase 2 was, again, more data collection, so then the community engagement piece. So we started those steering committee meetings, as I mentioned here. We continue with our data analysis and further data collection through the focus groups and through the survey. And then some of the survey, we opted to have the chance for folks to ask for more questions or have more information they would like. So we put that in the survey, and there was an opportunity for us to do some additional follow-up with those individuals and provide them with information and also get further information from them as well. So that was our second phase of it. Then we moved on to phase 3, So this is where we really started taking all this information we had collected, all of the different focus groups we had held, and looking at that information and just trying to put together this map. And I'm going to actually show you what we came up with. It's in this PowerPoint, so you'll get to see what the map looks like. As part of that too, we developed, I worked with a consulting firm to develop a system map brief. So it really explained those gaps and recommendations and things we might want to think about. And our last phase of it was really to go back to all of the individuals that had provided input into this process and give them the information that we had found. So we did a lot of presentations to different stakeholders who were either involved in the process, but even beyond that, we wanted to cast a pretty wide net and let folks know. So I'm still kind of in phase 4, I guess, because I'm doing a presentation to you as well, which is great to get you this information. Okay, so this is what this map looks like. It's a lot of information on one page. And this was actually a distilled version of it. It was even more comprehensive and more robust. And so we really had to kind of look at what we're trying to capture and trying to understand our system. So it actually, you can read it from left to right on the screen. And so when you're looking left to right, you will see the ways that individuals might enter the substance use disorder system of care. So this continuum looks at on the left-hand side, prevention and early intervention services. And there's a variety of different services that we're doing. We do some in schools. We do some with pregnant and parenting individuals. We do a variety of education workshops to parents, to youth. So there's different types of activities happening in the prevention side and early intervention services. And then we also do work within our court programs. And that's another way for individuals to enter into our system. So we have 3 different court programs. We have our drug court program. We have a driving under the influence court program. And we also have a dependency drug court program for parenting and pregnant individuals that are part of that as well. I apologize, I have a little bit of a throat thing going on, so I'm sorry if I have a little difficulty speaking. But these are our forensic services, and this is another way for individuals to enter into our program. We do have some services directly at Juvenile Hall, and that's our adolescent treatment program. And we also have some services now. We're co-located in Valley of the Moon, which is really exciting to be able to have someone directly on site. And one of our adolescent treatment program, alcohol and other drug counselors, is there on site at Valley of the Moon. So another way for individuals to come through is we're moving further to the right. You'll see that they might enter some of our non-crisis services. So we have a telephone line. It's not an access line. It's not to that degree, but we do have the ability for folks to call in, and it is 24 hours in the evening. Our detox program will answer that for those individuals that are in crisis, and we're able to provide and direct them to referrals and services as needed. We do have other programs that are in the county that we collaborate with, such as our HEART program and our IMDT program. These are the homeless outreach programs that are happening. And we do work with our Sonoma County hospitals, and even through local doctor's offices. There's intakes and referrals are happening there, for example, with medication-assisted treatment. And we'll talk a little bit about that in the next column over. We also have a section devoted to crisis and emergency services. So as you can see that we do have that 24, there's a 24 access line that's for our mental health individuals calling for mental health services. But again, they might be directed to our SUD line. We obviously have our CSU, and individuals do come through the CSU that might also be presenting with a substance use disorder. We have our mobile support team. And in fact, our mobile support team has some of the teams out there have an alcohol and drug counselor as part of their team. So they are addressing substance use disorder issues when they're in the field. And there are other hotlines that we might direct individuals to as part of our crisis services and response. And of course, we have all of our emergency departments. That's kind of an integral part of the work that we have here, and individuals entering into our system. We have a lot of referrals that come from the EDs into perhaps detox, or even directly into some of our programs. Continuing to move to the right, you're looking at the outpatient programs. So you see that we have our adult services, and we do have an outpatient program, and we primarily contract out for our programs. So most of our substance use disorder treatment programs are contracted out to community-based organizations. One of them is DAC, and DAC has these 3 different programs for adults. And we also have These are outpatient programs. We also have, like I mentioned, the medication-assisted treatment. That includes things like methadone replacement, so methadone maintenance, and also Suboxone and other types of medication-assisted treatment to help address different substance use disorder. So we have Santa Rosa treatment program, that is a methadone maintenance program. They do have a separate program within that we don't technically fund, but they have their own private pay program for Suboxone as well, which is buprenorphine, and it's another approved medication for substance use disorder. Excuse me. And then we do a lot of referrals to our federally qualified health centers, our QHCs. There's a lot of back and forth between there as well to provide medication-assisted treatment. We're actually in the process, it's not on this map, we are in the process of looking to open up our own program for naltrexone. It is a drug Medi-Cal mandated service. So we're looking to bring naltrexone, which is also known as Vivitrol, and it's usually given as a once-a-month shot. We find it to be very effective with someone perhaps exiting one of our jail programs. So that would be something we're looking down the future to put into place. We do have some dual diagnosis programs, some through DAC, that's the Drug Abuse Alternative Center, and also through Women's Recovery Services, WRS. Athena House is a residential treatment program through the California Human Development. They do address both on a co-occurring basis. They will address individuals that come into their services. Generally, they would have to present with substance use disorder as their primary diagnosis. They really can't necessarily manage the higher acuity individuals, and those likely would come through the crisis stabilization unit or other of our mental health services. And then we have a Step Up program and also our integrated recovery team program. And we're looking at providing more training for the SUD side and on the mental health side for co-occurring. Additionally, we have our community resources. So you see a lot of folks we just heard about, but we have a lot of our self-help groups are listed there, and we do a lot of referrals into those groups. And on the far right, we have our residential treatment and our sober living environments, SLEs, our primary residential treatment programs, and these are all primarily county funded programs. So this is for our Medi-Cal beneficiaries and Medi-Cal eligible individuals. So we have Athena House, again, that's part of California Human Development, Women's Recovery Services, where they have both perinatal residential treatment as well as treatment for women. We have Helen Vine Residential Services, that's actually in out of county. It's in the county of Marin, and it's part of Buccaloo. And then we have Hilltop, also out of county, and it's in Lake County. And then we have our Turning Point DAC. That is the residential treatment program for DAC. We have a few SLEs. These are the ones we currently are supporting. These are the SLEs that we support through county funds. And then there's some just additional programs here that are listed. We have the adolescent there's an outpatient program, and there's some different, and the code here kind of explains the different programs. Some of them are run by the county, funded by the county. So it just kind of explains how this is set up. It's a lot of information, and I can send the slide deck to Plar, someone to send it out if it's something folks would like to see a little bit more, kind of dig deeper into that. It's a lot of information. So what we found after all those conversations, all the focus groups, the surveys, meeting with folks, key informant interviews, that we had some key recommendations that came out of that. And here's the kind of the top three that really rose most of the top around internal processes. So we really realized there's a need to increase and improve bi-directional communication. You know, this is something that's been ongoing for some time. There's a need internally to really work, for example, more with mental health. We're really trying to integrate and find ways for us to be looking at things more holistically and as a more team approach. And so that is something that came out, and that was very much a resounding part and a recommendation from this process. We also want to look at continuous quality improvement. This is very important, that we are looking at ensuring that not only our contracted providers, but also internally, that we are putting in place ways of ensuring compliance and looking at the regulations and continuing to provide quality services to our community. And we also want to continue to do this process on a regular basis and regular intervals, because the needs of the community shift, and it's important that we just look at that as those shifts occur and that we're nimble and we're working to understand that so we can adjust and course correct essentially and make sure that we have the programs available to support our community. So that's some of the internal processes and recommendations that came out of that. Externally and through our program and service delivery, we looked at ways that we could improve the referral process. We did see that there are definitely some challenges along, as you saw, those ways that people can access, and there's not a lot of communication happening between those different buckets. So it's really important that those programs and those different ways people come into the system, that we find ways to streamline. And as we move into what I mentioned, the ODS, this waiver, there's going to be a need for us to have a unified access line. So, you know, it's that no wrong door situation where someone could just call and be able to access services they need. So that's going to be really a big part of this reform and work that we're doing right now as we move towards the ODS. We need to really work on increasing more peer support opportunities and really bringing more peers into our system of care. There's a lot of chances there, you know, in substance use disorder. It's something that I'm really trying to think about and bring to us, and this is hopefully under the ODS as we free up some of our discretionary funds. That's one of the really great things about the ODS, is that it allows us to be able to draw down from our drug Medi-Cal and not have to utilize all of our discretionary funding that we currently do to pay for residential treatment, for example. That could potentially free up some funding and allow us to provide even more services in our community. One of them I'm really looking at is the potential for recovery coaches, so peer recovery coaches to really help support and improve outcomes of individuals that are in a recovery. And then the third bullet here is looking at augmenting the current system. That's really about kind of the ODS piece and being able to bring in more resources into our community. And then lastly, we would want to continue. We heard it just earlier from West County Community Services that we want to look at continuing a hybrid service model. We heard loud and clear that it does help to increase opportunities for individuals who are more isolated in different regions that maybe don't get or have easy access into our system. And then, but continue to provide in-person services. We know the value of that as well. So those are some of the primary recommendations that came out of this process. And the big part was also preparing for the DMC ODS. This is a very big lift. It is a lot of work at the front loading and having to really get ourselves prepared. There's a lot that's going to happen, whether it's the combined access line or looking at our electronic health records and having a universal screening tool and a lot of training and making sure that our programs are trained on the ASAM assessment tool. So a lot has to go into it. So we were really looking at you know, the reasons to join it. We know that we're actually the last medium-sized county that has not yet joined the waiver. And you know, we're getting a lot of encouragement by Department of Healthcare Services to be part of this waiver. So they started actually a whole TA set of calls to make sure that we get more information and get us more prepared. So they are very much interested in getting us involved and part of this waiver. We are looking at the potential impact of the pandemic and really wanting to take a closer look at that. Oops, sorry, I have it in. So yeah, so there's a lot going on there. But we are getting closer. We definitely are, and we are working towards moving towards that. So that is the goal, and we see the need and the importance. I came from a county that did have the ODS waiver implemented, and I saw a huge shift of the funding and availability and increase in services and the amount of people who can be served. So I'm really looking forward to that happening here as well. All right, that's kind of where I am with this portion of the presentation. I did want to say some other really big things that we found are gaps in our services. One thing I wanted to mention was the youth treatment services was an area where we know there's a need to really build up our youth treatment services. We have some outpatient services. We have a little bit happening in Juvenile Hall and Valley of the Moon, but really there's no residential treatment available for youth here in our county. But really isn't in the surrounding counties as well. A lot of the counties are currently right now, our Bay Area counties are actually contracting with an agency in Morgan Hill. So it's a real challenge. So it's something that we're looking at, and we know that that's an issue, and we are considering Measure O and other types of funding sources that might be able to support building up our system of care here. So I will open it up to any comments or questions.
Are there any questions for Melissa?
Yes, I have a few. I took notes
I was going
throughout.
through- yeah, lots of stuff. Yes, please.
When you were doing the public surveys and all that kind of stuff, were you talking to current and former people who were currently in the process of dealing with drug and alcohol abuse?
Yes, we did go reach out to consumers. So we did, we had focus groups that were with individuals who are currently in the system. And then we also invited through our CBOs that we contract with, we asked them to invite individuals, and we had them send out the survey and make the survey available for individuals to fill out as well through the current CBOs and treatment providers.
Great. You kind of went over it, but were there any big, like kind of overarching universal comments and concerns that were coming out from the public as you were making this?
Yeah, I think the largest and most like kind of resounding was the issue around access and how people get into access. So we really want to reduce the wait times, making sure that there are more beds available. And I think a lot of this is going to get resolved by going into the waiver. Again, we have, limited amount of funding right now. By being able to go into the waiver, we actually will open up the potential to, have more residential beds. And so it could really make it be quite a big change and shift in our current system of care.
Great. To continue,
Right.
how do you plan on like getting this information out to the public that we have all these resources available? Like, so maybe it's like we catch them before they're incarcerated, like before they're in jail, or like, how do we make it known before they're in one of the facilities, just like, hey, you're out there, you're having trouble with this, you want a way out. I know you're talking about a phone number, but it's like, okay, we make the phone number, but how do we make the public aware that there's this phone number that they can call?
Right. So we have actually a very robust prevention program here in our county.
Mhm.
So we're doing a lot of trainings. We're meeting with parents, we're meeting with youth, we're meeting with adults. We have ways that we do those trainings. So we do a lot of kind of advertising of our system, and we're working to try, and reduce risk factors, promote protective factors to help reduce those individuals actually having to enter into our system. So, but there's a lot more to be done. But we've had longstanding prevention programs that we do. We have social media campaigns that we also have in place. A lot of our substance use prevention is around youth and young adults. We know that it's important for us to get them there early and get those messages out. So we do a lot of work there. We have a group called Friday Night Live that's in our high schools, and another group called Club Live in our middle schools. And right now we have 8 chapters. And this is a group of individuals that are really looking at ways to understand more about the risks around substance use and helping to, reduce stress, talk about a lot of different things that they learn. It's a youth leadership model. And so they're building a lot of resiliency there. And so they do themselves presentations to their schools. Lots going on through our prevention networks.
That's awesome. I think that's really great to hear. I would love to potentially see, if possible, some of these, like if it's easily made available with just like sending an email to Pilar, like some of these social media campaigns that are being put out. I would love to like take a look at those. I think when I was talking about outreach, like it's great when we're able to catch them in school, like because they're, it's organized, they're there. But I think I was more talking about like just that person who's alone, who's in their apartment, who's struggling, who doesn't know where to turn, I think that was more the area I was in, as just something to think about.
Absolutely. Thank you. Yeah, I think there's a lot of ways through our mobile support team too, as well. Unfortunately, usually they're coming up to a person in crisis. I understand that, but there are individuals who are trained, alcohol and drug counselors is there that might see someone dealing with an issue and trying to get them into services early on as well, and do some early intervention. So that's a good point. We got to think about, how do we get to reach as many people as possible?
Yeah, for sure. Can you go over what the DMC ODS waiver is?
Yes, I can. So this waiver came up as a way for in the state of California for us to be able to shift in our system of care, essentially. So it allows us to be able to draw down from Medi-Cal funds. Right now, how we're set up, we're considered what's called a state plan county. And through there, the regulations has it set up that we, for example, residential treatment, we have to use what's called our substance abuse block grant funds to pay for that. But if we were in the ODS waiver, we could actually draw down those funds from Drug Medi-Cal, and we could reserve our Srjc, or our substance abuse block grant funding, to pay for more preventative services and other types of services in our county, build up our withdrawal management. So this is a chance for us to really expand our system of care. And that's
Great.
how it's been set up through the state.
Great. And then I have one last question.
Sure.
And what is getting in the way of setting up youth care facilities, and why is it lack of funding?
Yeah, great question. So, it's not an anomaly. It's happening across, I mentioned many Bay Area counties are, kind of dealing with that. Residential treatment for youth would generally is kind of more of a last resort. There hasn't been, there's been some programs like in County of Marin, they had one that closed. There was Thunder Road in Oakland and a few other programs that have closed. Sometimes it just is for shifting services into an outpatient model, but we want to be able to have residential treatment available when needed. So I think for us, it's the funding right now, what we're looking at is actually through Measure O. So we might actually have some funding. I don't necessarily know about a residential treatment. That's quite a big lift, but we, be able to at least increase our outpatient services, improve our referrals, and maybe more case management services.
And rather, I suppose, like with a youth circumstance, like rather keep them in the home and like try and work on it there would be the goal.
Yeah, we're, usually like we don't, if we can avoid residential treatment, we want to do what we can. There's times when it's needed and we understand that, but if we can do it from an outpatient standpoint and a little bit less disruptive, then we'll try that route as well.
Okay, great. Thank you. That was a lot of questions on my part. But I
appreciate it. Thanks. Great questions.
So we do have a couple questions in the chat. Also, somebody, Mary Francis, one of the attendees, would also like to ask a question. So we allow her to talk, and then it looks like Carol also.
Great. So, do you want me to look at the chat, or are they gonna?
No.
Okay.
Mary Francis, you.
Can you hear me? I'll go ahead
Yes.
if I may.
Yes, please.
So, the chart or the table looks very impressive. I'm sure there's a lot going on, but what I have to tell you, although Sonoma County is a fairly small program, we talk with family members every week who have somebody in their family who is struggling with dual diagnosis, and they're not in services. There are large gaps, is what I want to say. And we weren't, when you did your surveys or focus groups, those were existing SUDS providers. But a group like ours was not included. We were not asked to share that survey with family members. It's just it's another thinking outside the box that you're not meeting the needs of, I think, many people in the county. It's not you, Melissa, because I want to work with you. I just want, we need to understand what is available and how to get people into these programs. And and my question was basically, are most of the services that could be made available once you're in the waiver really available to the Medi-Cal eligible population, as opposed to people with private insurance? Because I still see gaps.
Right.
Yeah. So we're, across the county, the county tends to, well, they're appropriately so, look at the needs of the Medi-Cal eligible population, but there is a large county out there and needs are high. And that includes people with private insurance carriers whose needs aren't being met. So I just, I want to stress that we really need services,
Right. Well,
one more.
Okay.
Oh, I was just also going to say, because I don't come from a Medi-Cal billing agency. When you say draw down our Medi-Cal dollars, I'm still putting that phrase, understanding it. What you are saying is that these services under a waiver could be Medi-Cal billable to Medi-Cal for the first time. Is that right?
That is correct.
As
It's
opposed
reimbursable.
to
Yeah.
having to fund them. Okay, so that is where that's a big positive change for our county.
Yes,
Okay,
it's a huge
thank you.
difference. Yeah, and just to answer
Yeah.
your question about a couple of things, the first comment you had related to kind of who is included. Yeah, we do our best to kind of bring in many different individuals, and we recognize that there's still more that we want input from. And that's why one of the things that came up was we need to regularly do this and look at ways and continuing to open up and get more input. So I think that this is just a start. I don't want to think that this is like,
Okay.
again, this is just the beginning of us gathering this information. There's more opportunities to do that. So we'll be looking at that and bringing in more individuals into that process.
Right.
Yeah, and I think additionally around just kind of what we're charged with from the county side, we're charged to work with our Medi-Cal beneficiaries and Medi-Cal eligible individuals. That's how the plan works, managed plan that we have. However,
Right.
we are doing some work we do, especially on the youth and young adult side. This is something that used to happen through a CAPE program. We don't have CAPE right now, but I'm working with Parents Leedy on the youth side to kind of develop a program through Measure O funding. And part of that would be to provide some support to parents if they do have private pay or other types of insurance, to work with them to support them even how to navigate the systems. Because when the parents in crisis too with their family, it can be really challenging. It's hard enough to navigate these systems. So that would be one part of a program that we're trying to build right now to help support parents who have private pay. So
That's good.
thank you for that. Yeah.
And I just to be clear, are we providing medication assisted treatment to anybody that was in the jail? Are we providing adult Medi-Cal eligible individuals with SUDS treatment now? Yes.
So MAT is happening
we
in
are?
the jails, but it's through the sheriff's. It's through there's a well path. There is a it's a contracted medical services there. Yeah, so there is an opportunity to receive services in the jail for that.
Okay.
Yes.
All right. Thank you.
You're
I
welcome.
appreciate
Thank
it.
you. Absolutely.
Yeah.
A few more hands raised.
Yeah, we have, Carol has a question.
Yeah, so hi, thanks. It sounds like some exciting stuff happening and some new funding sources. So I was wondering if you have any, well, it sounds like you do through your some of your programs, connection with the WellPath folks internal to the jail. Because one of the concerns that we have is this new 72-bed unit that is being built, the mental health services unit. And my understanding is that more than 50% of the inmates have either mental health issues or substance use issues or both, and that they often get lost to services when they're doing time or waiting to be sentenced, and when they're released, that there are a lot of reintegration issues in terms of support services. So that was one question as to whether you have a working relationship with WellPath. Are you involved in planning services for the new mental health jail? And then is there, can you tell what percentage of your SUD services are paid with MSHA money? And if so, would it be possible to get a connection to the CPP process? So Melissa Ladresh and the steering committee have a working group working on a proposal for increasing community input to program planning. And there is funding in the MSHA budget to do that. And the hope is that there would be an ongoing and permanent process for consumer input to program planning.
Okay, so to answer your first question, the WellPath, we have a limited relationship right now where I'm working with Sid McCauley and I are working. We both need to increase. There's been a little bit of leadership changing within the sheriff's department and the jail. And so we are trying to improve relations and get more access to that information and be more connected to WellPath and other parts of the sheriff's work that's happening. We used to have a SUD program, a treatment program in the jails, and that unfortunately do not currently have that. That went away with some budget cuts. So I am looking at ways to bring some services back. We do have our task program where we do work with individuals. We assess them while they're still in jail, and then we do bring them into services right as they exit. And we will work with them. We as case manage them while they're in treatment. And then we have several months after, up to a year of aftercare services. So we do work with individuals through that route, but more in service in jail. We need to really look at that. I'm not currently part of the planning services for the mental health portion, but I am, like I said, Sid and I are actually setting up strategy meetings to try and figure out how we can get more involved and be part of those conversations. And lastly, on the MHSA, I actually did approach Melissa. I've been wanting to ask, they do have PEI dollars, so they have, but really right now it's not. There was a program in the past they used to fund called Project Success. It was in 16 high schools. That's no longer in place. And I asked about the CPP process as well. I was told that it's kind of been spoken for, if you will, through like 2025 of my understanding. So I did ask to see if we could try and find ways to bring some MHSI dollars to our SUD side of the house as well. So, but as we start integrating and we start doing more of the co-occurring, I think there will be ways where MHSI dollars will be able to support activities that are happening in our county. So thank you. I think I answered all those. Yeah.
Melissa, there's a quick
Thanks.
question. What was the name of the middle school program you mentioned?
We have a middle school program called Club Live. It's part of Friday Night Live. It's a youth development program, youth leadership, and it's a statewide program. And we opt in, our county opts into that statewide program.
Thank you. I think Michael had comments.
Yes, yeah. Hi, Michael.
Yeah, thank you. Thanks, Melissa. I was actually part of I completed the surveys, got as many people as I could to complete them.
Thank you.
I'm associated with lots of recovery groups and actually sat in on one of the focus groups. So I've been anxiously awaiting. Thank you for all your work and putting this information together.
Yeah.
A few questions. Can you, under the augment the current system, are there more specifics that you can give us around that? Like what specific services you might be looking to add?
Yeah, great question. So the biggest part of the augmentation really is around the ODS waiver, and that would make things look a lot different. Like I said, as monies get shifted, we will be addressing the needs. We are trying to build up the youth treatment services, as I mentioned, so that would be another way we would augment. In jail services, that's another area that we're looking at very closely. Like I said, I'm really trying to partner with Sid, and she's our section manager for the forensics and acute mental health. And so her and I are really trying to work to build up those services. And another really exciting area is the state has received quite a few dollars towards infrastructure for behavioral health planning and infrastructure grants. So there have been several phases of that. We did just receive a planning grant, and we'll be starting the planning process. So I'm sure to involve many members of these individuals, here at this group. But we're looking at, and we have some interest in the idea of a sobering center. So we're really looking at this possibility of, having a place for individuals to go, so they don't have to sit in an emergency department, and maybe it's not appropriate for them to be in CSU and taking that bed up. So we want to see if we can kind of explore that idea and see if that's an option here in our county. And we're wanting to kind of do some planning around that. And also some adult residential and mental health treatment too, that we might be able to do some work with the infrastructure grants. So those are very competitive, but there was about $2.2 billion was being infused into California for this infrastructure program. So we're excited, and we're hoping that we can perhaps, get some funding through these different phases that are coming out.
Great, thank you.
Yeah.
Also, I'm interested because I've actually read through the RFP for the Crossroads to Hope, and I know that there are SUD services that are meant to be provided for that. Is that through the county? And if so, are there specifics about what those services would look like?
I don't have as much familiarity with that. I'm working with Sid on that. I know that that's, maybe I know Wendy's on the call here too with us. But yeah, so I'm trying to insert SUD wherever I can. I'm kind of becoming a broken record, but I'm definitely, see the need. So it's great that you bring that up, and I'm working with Sid on that. So wherever I can find opportunities for the county, even to provide guidance and support to any of these programs that are happening, we're wanting to do that as well. So that's great. I thank you for bringing that up. I will have a conversation with Sid on that.
Okay,
So,
great.
yeah.
And then last question, I actually worked at a substance abuse treatment center prior to working at WCCS. And one of the ideas, so the private payer and insurance consumers came up. What I can tell you from working there is that a misnomer is that if you have coverage that you get authorization. So many folks who are told by their insurance company that they have coverage for substance abuse services, that is only based on authorization. In my experience, most folks get 3 to 7 days authorized by their insurance company, and then the insurance company will advise that they move into an outpatient program. So along with that, I'm wondering if the county would be willing to explore like a scholarship type program where they could pay for beds at a reduced rate at the privately owned centers, like sort of a public-private partnership. I know there are oftentimes beds that are empty because folks can't pay for them, and if the county is looking at trying to add beds to the rolls, a way to do that without adding liabilities of infrastructure, would it be possible to potentially provide funds to the beds that are already there in the private centers?
Yeah, so we are looking at ways. For example, one thing that we do is anytime any grants come down, we've just received some supplemental funds, which is really an excellent opportunity. And that one of that we're able to do is we're actually going to be able to cover through our sober living environments, at least, we're able to cover 100% for several months at least. We're going to be able to cover quite a few people. And this is through some additional grant funding. So whenever this comes up, that might be an opportunity to augment some of this work or some of these opportunities for some of these other types of beds. I mean, our primary focus right now is just, we don't actually have right now enough beds to kind of, just even our Medi-Cal population. So we're trying to work on that and start there. But we do, I think as we build the system across the board, lots of opportunities are going to come up, and I think things will emerge and more grants, and we'll find ways to try and look at the system holistically and see how we can help support across the board. It's a good question though, but we're not there yet, but we got some work to do. So, but it's definitely a lot of discussions happening.
Very good. All right. Thanks again for all your work.
Absolutely. Thank you. Thanks for being part of the focus groups and helping us with that as well.
Melissa, you mentioned you might be able to make the PowerPoint available through Pilar to the board. Is that possible? Or at least
Absolutely.
the slide 6 would be useful. That chart, I think, would be
my
very
pleasure.
useful.
Yeah, I'm absolutely. I can send that off to Pilar so she can send it to the group and take.
Thank you. Thank
Sure.
you. Any other questions or comments?
Betsy has her hand up, and I hope I get everything did I get everything in the chat? I didn't know if I missed any chat.
Everything in the chat is current.
Got it. Okay, great.
So Betsy, if you'd like to go ahead.
Yeah, thank you. Thank you so much for the extensive presentation. There's so much work that has been done already, and I'm very excited to just learn more about the future, because it sounds like we're still in starting phases and making these connections, and I love that people are speaking up and that these connections are happening. I wonder if, so there are some gaps, and I'm wondering if we can continue this conversation to ensure that some of these gaps are filled, if more people come to the table, to your point, that are learning and are previewed to this information, because it's great information. I think a lot of folks would benefit from learning more about this. And also a question around how connected are you with Sonoma Connect, is in terms of streamlining the process or informing the public on how to go through this or how to navigate this process. I wonder, I'm thinking about ways of connecting.
So sorry, just your specific question, you repeat kind of like how what we're doing to connect with other agencies or get the word out to the community?
Yeah, just in knowing about Sonoma Connect and their efforts, I wonder if that connection has been made, and other similar connections to countywide efforts that are helping folks learn how to navigate or streamline processes so that folks can get information such as this.
I think we're definitely exploring. There's a lot to do there. And I've been trying to elevate SUD as part of the conversation wherever I can. So I'm always looking for ways to get the word out, and I do appreciate that. And I think we just kind of going through this process and this iteration, we learned a lot, and as you see, that we have more to learn and more ways we can connect. Right now, I'm the only manager right now in SUD. I'm the only administration right now, but we're trying to fill some vacancies so that we can do more of these things and have opportunities to get the word out and really expand these systems. So yeah, but there's different ways we do it right now, through social media, through our just our website, through different ways. But we have a lot to do around getting the word out through that as well. Thank you for that.
Yeah, and thank you. I really appreciate that. In any way that we can support as a board, as individuals, please let me know, fill me in. I'd like to support and help.
That's awesome. Thank you so much. We appreciate that.
Does look like Maddie has a question.
Thank you. Yeah, again, thank you for that presentation. It was very informative. And I guess my question's very similar to Betsy's. But I am with Srjc, and I wonder if you have a presence on campus. We do have a very, pretty, one of the few campuses, communities that's really surviving is our mental health and addiction support group. So I wonder if you have that connection, if I can help to strengthen it.
We do have these connections. We have some coalitions that we have in place. We work with Srjc and Sonoma State. So in our prevention world, we do a lot of coalition work and a lot of community building in that way. But I am always for additional strengthening and building. We wanted to be able to do more presentations. We have done some with Srjc. We've done some, just updating information, like we had cannabis trainings and things like that, where we're trying to get more information out about substances. There's a lot going on with the opioid epidemic, and we really do want, to provide further information about that and strengthen our connections. So I appreciate the offer, and I think you'll be hearing from me for sure, because I do think there are definitely more ways. I mean, it takes a village, it really does, and the more we can get the word out, the more we can involve these different groups, and the more we can just continue to connect together and do that. Happy to do so. So thank you for that. Yeah.
If no other questions, Melissa, thank you so much. Very informative. Good broad coverage. And
well, I just wanted to say about the coalitions, though, if it would be okay.
Sure.
These are open to the community, and we always encourage people to participate. We do have what's called the Prevention Partnership. It's been in place for almost 20 years. So it is a very robust group of individuals. It's currently chaired by the Deputy Chief of Police of Roanoke Park. And so it is, it's a mixture of, county individuals, law enforcement, CBOs, concerned citizens. So it's a lot of different folks coming to the different groups. That group has subcommittees. So we actually have an opioid subcommittee that's really focused on the opioid epidemic, like on things like Narcan education and getting the word out about that. So they're open to the public. I can, as part of when I send out the presentation, I can talk about when the next, some of the committee meetings are happening. And we'd love to have your input into that process. They're doing a lot of community development and projects right now. So it would be great to have this side of the house coming and joining us. So thank you.
Thanks, Melissa.
Thanks so much, everyone. I'm gonna head off. I'll send off the presentation to Pilar so she can take it from there. All right.
Okay.
Thank you. Have a lovely evening, everyone. Thank you.
There's still a hand.
Bye. I need to pass the baton back to Kathy. I'll give you a couple bits of information, Kathy, that we did not get to the roll call people were trickling in. So you might want to do that, or I can do it now. The other thing, we did not until you came in, have a quorum to vote on the minutes. So that's where we are at that point. And you know where we are on the agenda at this point, or the director's report, if we do that next.
Right, it looks like, yes. And it looks like you can take over my job anytime.
And I'm about ready to run out of steam, so I can do an hour and that's it. Okay.
Okay, so thank you very much, Bob, for doing that.
My pleasure.
I kept thinking I could keep my meeting to an hour or maybe an hour and a half, and it just kept going and going. And sometimes you just can't get up and walk out. It just isn't right. So thank you very much for covering that for me. So let's go ahead and do the roll call. Annabelle? Betsy?
Here.
Bob? Thank you.
Here.
Carol?
Yeah.
Me? Now, yes. Mary Ann?
Yes, here.
Michael Johnson?
Here.
Peter McElweeny? Peterson?
Yes, I'm here.
Bob Hales is on the list, but I'm letting people know that he has had some health issues in the last couple of months. And this morning, or maybe last night, he sent a note saying that he was going to have to step down. So it may be that you want to reach out and let him know he'll be missed. Vanessa?
Here.
And that means that we have vacancies. District 2, District 4, and District 5, and Bob leaving will make 2 vacancies in District 5. So if you know anybody. Okay, so we have then we have to approve the minutes of the previous meetings. January 18th, as well as, I believe, November is not approved yet. Am I right? You are good. Okay, so have you had the chance to, let's do the November one first. Have people had a chance to look at those minutes? I would entertain a motion to approve them. If you have had a chance to look at them.
Yeah, I'll motion to approve. It's Carol.
Carol, and is there a second?
I second, Betsy.
Okay. And I actually heard that I'm supposed to do a roll call. So I'm going to do it really quickly. Annabelle? Vote. The motion is to approve the minutes for November. Oh, she was one not here. I crossed her out. I thought that was a check. Oh, well. Betsy.
Aye.
Bob?
Aye.
Carol?
Yes.
Me? Yes. Mary Ann?
Yes.
Michael?
Yes.
Peterson?
Yes.
And Vanessa?
Yes.
Okay, Peterson, was that a yes?
Yes.
Okay. And for the January 18th minutes, do I have a motion to approve them?
Betsy, motion to approve.
Okay. And a second?
I'll second.
Okay. Any discussion? I'm going to do a roll call. Betsy,
Aye.
Bob,
Aye.
Carol,
Yes.
myself, yes. Marianne,
Yes.
Michael,
Yes.
Peterson.
I don't think I was present for the January meeting.
Okay, so abstain.
I'm
And
not there.
Vanessa.
Yes.
Okay. So that brings us to the Behavioral Health Director's Report. So which one of you lovely people gets to do that? Wendy,
I think it's me.
there you are.
Hi, Kathy. Thanks for having us.
Yeah,
Couple of
thanks for
updates. There's a couple of updates. So the Behavioral Health Division, particularly the Mental Health Plan, we had our external quality review last week. So we had 2 days worth of review sessions with multiple programs, providers, peers, etc. So we are expecting to get a draft report back from them probably within about a month, which we get to review, and then they'll give us a final, which gets posted. And so just want to let you know that took place. Provisional response from them is that they felt that more than many other counties, Sonoma County's really gone through a lot of disasters in sequence. And so they just wanted to emphasize how impressed they are that operations continue despite those things happening, that people are really trying hard to try to improve our system, even though we are often beset by major disasters. And so they wanted to give that feedback. They had some suggestions on things that we can work on around our psychiatry timeliness and a couple other, structural things that might be helpful. And they'll give us more of a formal report, as I said, expecting about a month and a half. So want to let you know that happened. Overall, very positive feedback from them. And yeah, it was nice. So other than that, the other things that are going on is the department had submitted a request to the board for approval for some additional positions in the Behavioral Health Division so that we could expand capacity. And that was approved last week. So there are going to be some additional positions in youth and family specifically that'll be helpful on the clinical side. But also we're looking at some positions to kind of do key capacity gaps on the adult side as well and in the crisis services. So we appreciate the support of the board there in trying to help us staff up to meet the needs of the community. As you're aware, across the state, COVID has had a pretty devastating impact on staffing levels in all of our safety net systems. So to have that support from the board is really helpful for us to continue our operations. So those are kind of the two bigger items. And then on the quality side, as you're also aware, at the state level, they are actively working on the CalAIM initiative to overhaul our Medi-Cal system as it pertains to specialty mental health and SUD. So one of the first big items was to submit our quality implementation plan around that effort at the state level. Christina Marlowe was successful in getting that turned in on time this week. It was a major lift. We got a lot of support from Cal Mesa. They were providing support to all the counties on how to frame those. And so for those who aren't as familiar with that process, they're looking at a couple major areas around payment reform and documentation changes and access to services and data sharing, interoperability, things like that. So there's a lot of different areas in our system that's going to touch overall. It's going to be a 2 to 5 year process of rolling milestones to go through that formal implementation. So it's going to be a big lift that is being done across the state, and we have several work groups already working on it. So let's see, I think those are the big highlights that I can report out on today.
Carol.
Wondering if you can give us an update on the hiring of the new behavioral health director?
My understanding is they're in the final stage of that selection. And so a position like that, the person offered would probably have to give a fairly lengthy notice. So we would want to expect probably about a 30-day. So if that were to happen soon, then you would anticipate sometime in March potentially being when that person might arrive. So we're anticipating hearing an update about that anytime now.
I appreciate that, and I hope you apply next time. You've done an awesome job.
So do you have information about the PEF opening?
Ah, yes. So sorry, Kathy. I meant to talk about that and whoop, just went right over me. Yes, very exciting news. The PUF is open and receiving. I know. Some of you participated in the open house that they had. They have a virtual walkthrough that they posted online. So I believe that that's something people could look at if they wanted to see what the site looks like in the program. But yes, so Crestwood has opened a psychiatric health facility. That's what PUF stands for those who aren't familiar with the acronym, on the Los Galicos site. And it is quite lovely, and it is receiving clients. So that is very exciting.
Okay, any other questions for Wendy? Maddie?
Yeah, I just wonder if you could elaborate on the process of the review you mentioned at the beginning, like how were people invited? I hadn't heard anything about it, so let's go for more.
Sure. So annually, as part of our contract with the state, we are required to undergo an external quality review. There's a specific entity in the state called Behavioral Health Concepts that the Department of Healthcare Services has contracted with to conduct those reviews. So that it's independent of our state governing body, if that makes sense. They have specific things they're looking at. So they want to look at access to services, timeliness of services, the quality of services being reviewed or being provided, and the outcomes, the clinical outcomes that are taking place. They also look at some of our structure and operations and our IT support and information systems capacity underlying that as a supportive structure, and kind of assess, is it sufficient to do what we're trying to do, or does it, they make some recommendations around that as well. It is a process led by the external reviewer. And so what they do is they indicate to us kind of what focus groups they're wanting to have, and they have different ones each year. And so most of the sessions are going to be review sessions with like the quality managers responsible for those areas. So we're reviewing our internal policies, procedures, things like that, workflows. But they also do focus group sessions. That's different every year. So it would be like sometimes they'll have a focus group with contracted providers of the mental health plan, for instance. So it would need to be a Medi-Cal rendering service. They don't review other pieces of the system. And that would be an invite that would have gone out to contract providers for that focus group as an example. They'll often do member focus groups where they want to talk to people receiving services. Those go out a variety of different ways because they need to remain anonymous and so forth. They will meet with some of our peer operators depending on the year. So hopefully that helps explain kind of how that's done. Okay.
Thank you.
Okay, other questions for Wendy? Okay, thank you, Wendy, for doing that. I'm looks like there's a couple of things Carol, thank you, Carol, has put into the chat. If you want to look at the video tour of Crestwood and some news about it. Okay, anything else that we've forgotten to ask you about? Can't think of a thing. Thank you for your report.
You're most welcome.
Okay. So, acknowledgement of Sonoma County behavioral health staff. And we chose to acknowledge the work of Dr. Daniel Flevin and Bleeman. Is it Bleeman?
Yes, Kathy, thank you. Thank you very much.
Yes, and so we have, as you know, it seems like there are, it's hard to get people to come who do good work and are willing to get involved with, different parts of the system. And I personally have really appreciated seeing you show up in multiple places, multiple meetings in different parts of the system. And I've appreciated the questions you ask and your obvious concern for the county's clients. And so I appreciate that you are here. And I don't know how many other people know what work you've done, but I know that there are some. So if anybody else has anything that they would like to say to Dr. Bleeman, then now is your opportunity. Everybody's jumping in right at once, but we definitely do appreciate the work that you have done and the time that you have spent here. So you will be getting, as Susan said, put together a certificate of appreciation. So thank you very much.
Yeah.
Yes, Carol.
I just want to say thanks. I know that it's long and hard work and often invisible work, and I don't know all the things that you've done, but I do know that you were part of the MSHA work group looking to kind of elevate participation of end users into planning. So I was really very pleased that you accepted that extra work. So thank you very much. And I hope that when you have had a chance to retire, that like our behavioral health director, that you will come back in some shape or form, and that we get to still work with you.
Thank you so much, Carol. Thank you, Kathy. Thank you very much. I'm touched and honored.
Okay. So thank you. You're appreciated. And I hope you enjoy your second retirement or third. I don't know what it is, but enjoy.
Second try. Thank you. After May 31st will be my last day, and I'll try it one more time. See how long it lasts this time.
Well, you're always welcome to pop back, Bob?
If you happen to be attending subsequent mental health board meetings prior to your departure, if you're so inclined, are there a few, not now, but in one of the subsequent meetings, are there a couple of recommendations or thoughts that you might make suggestions regarding both the mental health board's endeavors and behavioral health department division in general, that you might leave us with some wisdom given your experiences here?
Thanks for asking, Bob. I appreciate the request, and yes, I would love to do that. It maybe in March or April, or at the very latest May. I hope before my last day that I'll have a chance to prepare some remarks, hopefully together with the new director of the division. We're looking forward to that, and the medical director must collaborate very closely with the division director. And I also hope that the department director will be formally announced, and I have personal preference for who that should be. I won't say here for political reasons. And I have some ideas about the division director as well. Also, I won't say here for political sensitivity reasons, but I'm looking forward to collaborating with both of those people for the remaining few months and all of you. And I would very much like to add my, my observations together with those new people and report back to the board over the next couple of months. Thank you, Bob.
Thank you.
I think Mary Frances had something to say.
Just very briefly, Dr. Blyman, I just wanted to say my connection with you has been through the Quality Improvement Committee meetings. And I just wanted to say that I have very much appreciated your kind, calm participation in those meetings. And it's been a pleasure. So thank you for all you've done for Sonoma County. Thank you.
Thank you very much, Mary Frances. I've enjoyed working with you in that committee as well. It's an important committee, as is this one. And I think that improving collaboration and communication amongst all of us is key. So thank you for that.
Okay, so again, thank you, Dr. Blumen, for everything that you've done, and we will move on. So
thank you all. Thank you so much for the.
Okay, mental health board site visit replacement. At this point, with knowing that Bob Hale is not going to be with us, we really do need to address who is going to take over that role. And whoever it is doesn't necessarily have to do all of the site visits, but we do need a coordinator. It may be something that
I did indicate in the last meeting I wanted to.
Say that again.
I did indicate at our executive meeting that I wanted to.
Okay, I did somehow miss that. I am putting you down, Peter.
Yeah, I had it in the chat room, so you may have not looked at the chat.
Yeah, it's absolutely possible that I missed it. So, yeah, and I can definitely help that with that once, starting maybe in July when I'm not here doing this. I don't know. So Peterson, I'll work with you on that. Okay.
Sure. All right. Yeah, sure. I need some
Perfect.
help to get it going. Yeah.
Perfect. And we can look at the next executive committee meeting. We can look at maybe putting together a list of places that we want to visit. Okay, so it is time, Maddie, for the Peers Coalition intern report, and that would be you.
Yes, it is. Hi, everyone. I think I know most of you, but my name is Maddie Cottrell. I'm an intern with the Peers Coalition, part of Student Health Services at Santa Rosa Junior College. I do have a little bit, I'm going to do a funny little thing with my background here, hopefully, if I can do this, because I was not able to load in a presentation, but I do have a couple things I want to show. So Student Health Services' main focus is destigmatizing mental health and treatment on Santa Rosa Junior College's campus. We historically have done that through a series of different things. One of the things that we do is we partner with Student Health Services as a whole to promote changes being made, promote access to our health services provided, provide direct education to various clubs. I myself am also a member of SGA and various other organizations, and I work in my capacity to try and build bridges between these various organizations. So first off, our health services building has moved since last I saw you. We are now located in Bertolini on the 3rd floor. And with that, I thought I'd share. You can see over here, over there, that's the building that we've moved to. So that's one way that we serve on campus. The second is that we provide events for students to connect with each other, to create a safe space for dialogue and for peer support. We do that consistently through Wellbeing Wednesdays that are held every other Wednesday. They look like this. Our next one is actually tomorrow night. And we do them in various themes. We often hold nights that are mindfulness workshops where we run through a couple different mindfulness methods and meditation techniques. This week's theme is Dreams and Future, a vision boarding workshop. I think it's something to look forward to, and we invite members of the community. Unfortunately, our Wellbeing Wednesdays, like much of Santa Rosa Junior College, is not very well attended. I think I mentioned the last time I was here a couple months ago that attendance at Srjc is very, very low. It is low across the state. Those numbers, I've actually brought some data on that for you as well, and I'll get to that in a minute. So seeing that we've been holding these every other week since fall, we've decided to try and take some different tactics. As I mentioned, my capacity is to build bridges. We've had some criticism last year, about some of the peers' approach in specific spaces. They did some presentations that were not as culturally focused for groups. So one of the things that we're working on now is building those partnerships with events. So last night we held our first cooperative event with the Santa Rosa Junior College Queer Resource Center, a Be Our Palantine event that is a non-romantic event as an option for February 14th. It also was not very well attended, to be completely honest. It was great. Some of my favorite people were there, but we didn't really bring in the numbers. I'm going to pause, pull this off my screen. I'll just give you the last one. Last little slide is that we are also on Instagram. It's our social media is one of the few things that has kept going through the pandemic. People are not off there any at all. They're still on there. So we have spent a lot of time focusing on our Instagram presence. We are about to kick off excuse me, there's too many programs. We're about to kick off Wellness Wednesday, which is a series, an Instagram series in partnership with the county, and I think Each Mind Matters. So that's where you can find us there. One of the things that we are struggling with is obviously attendance. Getting student involvement in any capacity on campus has been extremely difficult. We are currently going through as campus-wide a strategic planning town halls. The first of those was on this last Friday. During that event, we were given a snapshot of overall trends in enrollment. And as of 2021, our enrollment sits at 28,000, whereas in 2010, we were approximately just halfway between 41 and 42,000, so 41,600. So like most of the schools in California, we are seeing a kind of a desperate need for student participation. As I mentioned, I'm also in SGA and I do a lot of student involvement work on campus. And I see it across the board. The students who are participating are really participating. And a lot of them are actually facing mental health risks because of it. You know, I myself have been in classes and meetings, luckily only since 8 this morning on Zoom. So aside from the strains and like little horn that starts to develop in your back of your neck. The students who are engaging a lot are also experiencing a lot of anxiety and stress around that. Another one of the concerns that we have as a campus is that while we're in this remote learning environment, different families and different household structures are experiencing different struggles. I host Queer Resource Center's weekly Queer Corners. I'm also an intern there. And we unfortunately are also having drops in participation. But when we do have participants, sometimes they are in literal closets trying to hide themselves from their family. Because of this, my partnership between these two centers, Peers and the QRC, is going to be amping up. We are going to be hosting our first workshop of the semester, which will be a school-wide event, and that will be happening on March 9th. I'm currently in development phases, and we're actually hoping, I hope Mary Frances is still here. I can't see who was in the meeting, but one of our goals is to actually follow up with participants from the Path to Hope conference that happened in the fall, to try and bring in members of the community who are already engaging in the work of bridging and developing a better understanding of mental health within the LGBTQIA community. One of the biggest threats that I see within that community is that there's still a lot of entanglement between archaic ideas of what sexuality and gender are as defined by the Diagnostic Statistics Manual and a modern understanding of identity and gender. So that's a snapshot. We are really looking for people who are interested, and we will be sending out an email tomorrow about that workshop upcoming. So I hope I didn't speak too fast. Any questions?
I have a question. Can you make sure to send that email to Pilar so it can be forwarded to the rest of the board?
Absolutely.
I think that would be really good for us to read. And I definitely hear what you're saying. I think people are starting to understand more that their mental health is important, but they are not yet actively taking the step to start working on that. They don't know how to talk about it. There's such a big stigma around it in so many communities that it's hard to even, I think, for some people, know where to begin. And I'm sure you are feeling that yourself. I see that as myself too, is like, well, that falls on us to find ways to sort of bridge the gap and get to the people and make it take the weight off of the conversation around mental health. And in my mind, I think it needs to be lightened a little bit, to be more accessible, to be more like, hey, yeah, we're talking about mental health. No big deal. This is just what we do. Like, we talk about mental health because it's fun to talk about and it makes us feel better. I know that sounds funny, but that is kind of how I look at the conversation. Like, that's the way that it needs to go. I think it is obviously, it's like, it's all, super sensitive and very important, but I think through the like big weight that it carries, like, makes it harder for people to talk about, rather than just kind of being like, hey, let's have a laugh over our mental health struggles. It's kind of how I think to approach things. And that's a lot of rambling.
No, thank you. And actually, in my capacity, one of the things we're trying to examine is tactics. How do we approach the community? How do we, historically, we've been able to say, this is a space and people have come to us. Now we're looking at how do we really get to them? So partnering with other student groups, like Students for Recovery and our Second Chance Club, or formerly incarcerated students, and getting into the spaces where students are already at. So thank you for that. And Carol.
Carol?
Yeah, thank you for your presentation. It sounds like you're doing a lot of work, and I feel for you with the low attendance. I know what that feels like to put all that work in, and but would like to maybe invite you to consider yourself or somebody from your team joining the MSHA CPP work group. There will be funding for training facilitators, for listening circles, and there will be funding to pay people to attend the listening circles. I think that the LGBTQ community for sure is a community that has not been underrepresented. And so we'd just like to invite you to be part of that. And then the MSHA stakeholder meeting, which is open to the public, is this Thursday on the 17th from 12:30 to 3. And I will put this information in the chat box. We will have breakout sessions. And one of the questions is, how can we create safe containers for conversations to feed back into the planning process? So, and then also, how do we reach folks? And I think it's a real challenge, especially with this COVID business. If you don't have people's direct email, or you don't have, events where you have food that can draw people in. People love food. And I know that the JC has used the dogs, those really beautiful, soft, gentle animals to also encourage people's participation. But yeah, I think we're all struggling with that. And then it sounds like you do already have some events planned for May. May is Mental Health Month. So Melissa Ladresh is putting a calendar together. And so if you have some events that you would like to be publicized, I will, if you don't already have it, give you Melissa's contact information to have that in the county calendar.
Yeah, I would love all that information. That would be super helpful.
Okay.
Okay, and am I on? Yeah, Maddie, Mary Frances Walsh is still here, and she said she'd love to connect with you.
I'm so grateful for that too. And you'll get a email tomorrow, Mary Frances. Thank you. You're on my list.
Dr. Bleeman? You're muted.
Sorry about that. Thank you. Thank you, Kathy. I just want to say, Maddie, I'm very happy to meet you. I was very impressed with your presentation, and I want to encourage you to keep the faith and keep doing what you're doing. And I hope your attendance improves. I hope you find ways to increase the participation, because I think what you're doing is really, it's beautiful and it's so important. And I think if you persevere, it will pay off, even though it seems kind of frustrating when you don't get the the participation that you hope for. But I trust it will come, and just keep the faith. Yeah.
Thank you for that. Yes. Yeah, I mean, yesterday's event, even with no participants, we've kind of developed a motto now. It's if it's an attempt, it can't be a failure. If the space is there for someone, it's success.
Exactly. I've made mistakes many times in my career of trying to influence things quickly. And it's then I've gotten myself into trouble. And the real true progress is gradual progress. The real, it's the perseverance and the, over time. So yeah, thank you for what you're doing.
And that's
Thank
why
you.
we appreciate you, Dr. Bleeman.
Yeah, and I'm going to abandon you in a few months. Just I have 2 years with you, and it'll be just shy of 2 years, but it's been great. And I look forward to being here at least one more time before May 31st. Thank you.
Okay, any more questions for Maddie or comments?
Looks like Betsy might have a question.
Betsy.
Yeah, I'd like to also echo everyone's sentiments. Thank you so much, Maddie, for your presentation. It's amazing the work that you're doing. To maybe promote what you're doing, would it be appropriate to reach out to some of your youth or high school students to attend. I think that they are always looking for venues to seek information and support, such as what you're providing. There are, like, for example, there's Dale, there's a leadership group that is in motion right now. Has been very engaged with the community and working on several initiatives themselves. And so I wonder if an invitation to them would be appropriate among other of their groups. What are your thoughts?
Yeah, I would love that. I was actually kind of surprised. I'm new to the JC. I've only been here since last year, and I was surprised during our strategic planning meeting that there isn't a lot of infrastructure around outreach to students, high school students. Actually, we see that in our stats too. The majority of students at the JC right now are actually between the ages of 25 and 35, which I was like, oh, that's my age range. That makes sense. But yes, I would love for students in Sonoma County to know what they have as options at the JC. And I will drop my email. I just got my official school email. So I'm going to go ahead and drop that in the chat, and feel free to reach out to me or send anyone my way.
That's great. Yeah, as somebody just mentioned, Latino service providers, they do have a robust program that works directly with youth throughout Sonoma County, I think, including some of the centers of JC students themselves. So I think it'd be great to plug in what you're doing through the various outlets that work specifically with some of our youth. I think that would be very influential and needed. So we'll be doing that.
Thank you. Yes.
Okay. So thank you very much for your report, Maddie. Thank you for being here, and thank you for keeping working on this, because like you said, it can be frustrating. So thank you.
Thank you.
So I'm going to again remind people that we have some vacancies out there. District 2, District 4, and now 2 in District 5. So if you know of anybody that you can, let know that we're needing people, let them know. And I'll be looking more closely to figure out exactly what categories we need to keep our balance. But yeah. So are there any items that are not on the agenda that anybody wanted to bring up? I don't.
Maybe this is Carol. Just a reminder, when we are recruiting for the board, that you can only serve on the board if you are not a recipient of funding, unless you are a peer, a peer. Yeah.
And if you are a peer and working for one of those agencies that's funded, you're okay, unless you are in some way responsible for, the funding stream. So, yes. Okay. Anything else? If not, I will entertain a motion to adjourn.
Betsy, I motion to adjourn.
Okay, Betsy, a second.
That's me. Daniel.
Sorry. Didn't put up my hand.
Okay. Did you have your hand up for a question or something, Dr. Blevin? Okay. Okay.
No, who's going to second the motion? It's been nice.
Well, we could do with the third if you'd like.
Okay, so I shall see everybody at the executive committee meeting. Okay.
Sure.
Thank you.
Everyone. Good night.
Thank you.
Thank you,
Have a good
everyone.
evening. Bye.
Take care. Thank you.